Welcome to Straight Outta Health IT. Getting into health tech is rough, but here's an unfiltered dialogue of healthcare leaders and influencers covering a wide variety of issues affecting healthcare and the health tech industry. And now your host, Christopher Cunny.
Hello, everyone. This is Christopher Cunny, and welcome back to another episode of Straight Outta Health IT. Today, we're coming to you from the 2024 Regional HIMSS Conference in Texas, and I have the distinct pleasure of having as my guest the Mr. Hal Wolf. I said the Mr. Hal Wolf, the CEO of the Health Information Management Systems Society, also affectionately known as HIMSS. Hal, thank you so much for taking time out. I know it's a very busy schedule for you to have this conversation with me.
Chris, it's always great to see you, and I'm really happy to be here.
Thanks, Hal. Thanks. Well, let's go ahead and jump into this because I know I'm standing between you and the keynote that you'll be doing shortly as well, too. First of all, I want to start with, for those individuals, the one or two individuals that might be out there that have never heard of HIMSS, could you maybe just do a quick elevator pitch on what is HIMSS, what's the value of it, and just any general information you want to share about it?
Sure, I'd be happy to. So HIMSS began in 1961.
Right.
Out of Georgia Tech.
Yeah, no jackets.
Yeah, exactly.
I'm a Georgia Tech grad.
Are you really?
I am.
I didn't know that.
Yeah.
So my grandfather went to Georgia Tech.
Oh, cool.
My uncle went to Georgia Tech.
Nice.
So we'll have to come back on that one.
Absolutely.
And I'm Wake Forest.
Oh, well,
so we play each other every year.
Yes.
So now we have a betting line.
There we go. Absolutely.
So it began in 1961, and the computer science professors at Georgia Tech had this crazy idea.
Right.
That if you began to look at information, you might be able to help healthcare.
Absolutely.
Crazy talk.
Yeah, well.
And then soon a bunch of academic institutions began to get together. Inevitably, HIMSS was formed without the I.
Right.
It was healthcare management,
the
systems society, and then the information came in later.
Okay.
Because they were thinking data back at that time. They weren't thinking full information. And there was a big discussion about it when they brought the I in.
Right.
And I've had the chance to meet with some of the people with that discussion.
Some founders.
Yeah, it was really cool. Yeah. So we grew, I think, pretty rapidly as a part of the IT and the academic health environment. And then, of course, Help IT became cool.
Absolutely.
And it really exploded during the meaningful use years. And this is also when the conference, now known as the Global Conference, became very large.
Exactly.
And when I had the fortune of coming in almost 7 years ago,
right,
which is...
I was going to ask you, tell me your journey, your story about...
Yeah. Well, I was a member for many years. I've been a member for 20 plus years.
Okay.
I was fortunate enough to be asked, after being a member for so long, to be an advisor to the board.
Right.
Because at that time, the way the board was composed, it was like outside elections, and the CEO had the opportunity to say, well, I also like these people to serve as advisors.
Sure.
So I did that for a couple of years, and then I was put on the board and eventually became vice chair.
Right.
And then when Steve retired, I was fortunate enough to be asked to be the CEO.
Wow. Congratulations.
Thank you. I think. No, it's been great.
Absolutely.
It's been great.
Yeah.
So at that time when I came in, we had about 78,000 members, and largely all in North America.
Right.
And one of the main attributes that I wanted to see the development of HIMSS was really create a global presence.
Make it international presence.
Make it international.
Absolutely.
Today, we have over 125,000 members.
Wow. How many countries?
That's a really good question.
Yes.
We have members in over 50 countries.
Oh, wow.
Yeah. And active members.
Exactly.
So there's a difference. I mean, there's members and there's active.
Sure.
And we have active members in over 50 countries.
That's great.
And we've grown dramatically in Asia, Middle East, and Europe.
Wonderful.
So we're very pleased. And in fact, in 2 weeks is our Rome event, which is our European conference.
Man.
So we're very excited about it. HIMSS has become extraordinarily relevant around the globe. And what we really do, and back to your original question, it hasn't changed in many ways in the sense that HIMSS was labeled a society, not an organization or
mega machine it has become now.
It's society, because in healthcare, you really cannot exist without having multiple disciplines participate in trying to accomplish something.
That's right.
Right. Association,
Exactly.
have a tendency to be narrow, and societies are wide.
Right.
HIMSS is wide. We focus on thought leadership. We love to develop best practices that we develop amongst our members, which get reflected in our maturity models.
Exactly.
We lead in the helpful direction of developing digital health solutions on a global basis.
Sure.
And we work with clinics, hospitals, governments. So we're both thought leadership as well as very practical implementation. We have a wonderful media group that does magazines like Health IT News.
Thought leadership.
It's all about thought leadership. And when you walk into events like here in Texas, 60% of the people that will be here are on the provider side.
That's right.
Which is fantastic.
It's huge, absolutely.
And what they're doing is exchanging not only war stories, but actual practical strategies and implementation, best practices, understanding what's happening globally, both strategically as well as regulatory.
Right.
And that's what HIMSS creates. It creates a unique environment for 365 days out of the year. You can tap into your brethren and you can look up and say, okay, I know someone I can turn to help me with this.
That's right.
And, oh, that person's a thought leadership in that area. I'm going to ring them up. And locally, what's going on in the market.
Exactly.
So it's really driven off of that value statement.
No, that's great. And to, really emphasize your point, I mean, I'm from Georgia HIMSS. There's several of my colleagues from Georgia HIMSS who are actually here today at this conference as well. Not only just here as participants, but actually speakers and panelists and others. So it really is a community of folks who come together to try to support each other in their endeavors. And so that leads me to my next question. And again, congratulations for all the success, the growth that's happening in HIMSS as well. But let's think out now for the next 5-10 years, what do you envision over this next decade, in terms of what HIMSS will evolve into? And what are some of those specific initiatives you're focused on that you're prioritizing to make that a reality?
Yeah, it's a great question. Sure. I think to understand the future, we have to sort of recognize this journey we've been on.
Right.
So there's a little bit of the back to the future component. HIMSS grew as a society. It was extremely valuable for multiple organizations and multiple folks in different components.
Right.
Then we also began the global conference. The global conference sort of became the center of the universe.
Exactly.
With our partnership with Informa that we developed last year.
I asked you about that. Yeah.
It took a big chunk of operational responsibility off of our shoulders and allows us to focus on the content. So by focusing on the content, there are two aspects that are really the future of HIMSS as they were before.
Right.
One, really focus down on the thought leadership, and second, and most important, membership value.
Exactly.
And membership comes in three flavors, right? There's individual membership.
Right.
There's institutional membership, and meaning in the provider space.
Right.
And there's also the market suppliers.
Exactly.
Who are part of
a big part of this. That's right.
And because, again, it takes a village.
It does.
It's an old statement, but it's very true.
That's right.
Right. And as they say, if you want to go fast, go alone, which really doesn't work in healthcare.
Right.
And if you want to go far, you go with others.
That's
and
right.
you go together. So that's where we're headed. Okay. It's about thought leadership. Right. It's about the member value. We want to make membership in HIMSS at the provider level absolutely a phenomenal piece. And if you're a member of HIMSS, we want you to use this every day.
That's great. That's exciting. And you see that again on a day-to-day basis at the local level with the thought leadership, the very diverse group of individuals who participate in this organization. To your point, providers and payers and technology companies, academic institutions, individual contributors, all, now the investment community and others who are making huge commitments in supporting the mission and vision of this organization.
No question. Yeah. But in the end, even with all those incredible people participating, just like you, part of the Georgia team, sitting here in Texas, learning from each other, contributing to each other.
Exactly.
That's what makes this such a special society.
That's what's so powerful about it. It's a community. It's like a family almost in many respects. People reach out and say, hey, can you come and support our event? It's absolutely. And vice versa. So you just got this massive amount of resources at your disposal across now the globe that you can tap into to provide that thought leadership, that support, get those insights as well. So let me ask you, the landscape, of healthcare is rapidly changing, as always has. Now, especially with truly embracing technology to be a component of it. I like to say now that IT is the next utility. You can't not run a hospital, healthcare system or anything now without IT in some form or fashion. It shapes everything that we do. How is HIMSS playing a role in shaping that future around healthcare delivery, adoption, and interoperability.
Yeah. So let's go back to that first point you made. And I agree with you 100% that, and I'll just use the word data versus IT, but I think the data is absolutely...
That is the currency.
A fundamental currency, right? So if you go back to the late 1800s,
right?
I mean, literally in the beginning of the 1900s, hospitals had individuals whose job it was to figure out if and where electricity should be used in a hospital.
Oh, interesting.
So you almost had a chief electrical officer,
right?
You know, today we don't look up and even think about the existence of electricity. It's assumed. The only difference might be the red plug, which is continuous, versus the non-red plug.
That's right.
And that's about it.
But there's still an expectation. You walk in there, you flip that switch,
and it's there.
And it's there.
And I think data, and more importantly, information that we derive from the data, that's what our future is.
Absolutely.
So where does HIMSS get involved? So HIMSS gets involved in a couple of spaces here. One, we're deeply involved through government relations and our members.
Sure.
At the state level, regional level, and national level. And this is global.
Right.
Thinking about the regulatory ecosystem that we need, interoperability falls into that, the use of AI, responsibility of cybersecurity,
absolutely,
protection of data at the individual level, but also access to the information we all need to create a better future.
Right.
HIMSS dogmatically believes that digital health is an absolute requirement in order to take care of the populations moving forward.
Exactly.
And if anyone doubted it before, and there were many, the pandemic changed all that.
It just opened up the door, right? For the 100%. Possibility, for the lack thereof in some cases of data, right?
It was,
and now the possibilities that exist to expand beyond our normal way of delivering care to more innovative approaches like virtual care technologies, et cetera.
I agree 100%.
Yeah.
And when you look up and you recognize where the changes are occurring, this gets back to the global piece.
Right.
The reason it's so critically important for us to be engaged, as an example, not only in the Americas, but in Europe, is that Europe's been leading the way in the development of the regulatory space around AI and access of data. And their regulations swing back into the United States.
Sure.
So if we're not engaged on a global basis, shaping the conversation, we're either going to be impacted by it. You can either lead, follow, or get out.
That's right. All right. Or be a casualty of it.
And be a casualty of it.
Right.
And really what people have asked HIMSS to do is to be a part of the solution finding, be a part of the thought leadership, help shape it globally, but through the lens of unique regions. And that's where we're engaged. So over the next 5 to 10 years, I think you're going to continue to see significant growth in the involvement of HIMSS at regional and country levels.
Exactly.
We have been engaged not only in the United States, like through the Department of Defense, the VA, but overseas in measuring Germany. We're doing measurements in Italy right now. We're having conversations with France. We're on the legislative responsibilities in Portugal. We just signed an agreement with Indonesia. We have an agreement in Korea that we just signed, an MOU. We will be signing an agreement with the Turkish Republic in 2 weeks, back in Rome. So at a national and regional level, HIMSS is being turned to as the de facto standard. And we embrace that because the standard isn't developed by people sitting in an office, as you know.
That's right.
It's our whole membership coming together to make it happen.
Absolutely. That's, and again, congratulations on just, the reach now that HIMSS has and the influence it has, not only domestically, but internationally, and really shaping, healthcare policy, encouraging the adoption and investment in technology, innovation, and the people that need to lead it and drive it, and creating this community of folks worldwide that can help to weigh in on the direction and vision of healthcare in the future. I wanted to talk a little bit, and I know we're going to be, because I got to get you back on the podcast, there's so much more I want to talk to you about.
We can always do more.
Yeah, we'll do a series here. I wanted to talk about, how does an individual who is new to healthcare, who's trying to learn about it, gain an appreciation for it? How do they take advantage of HIMSS?
Yeah, it's a really good question. Let me give you a profile study.
Sure.
Last year, I was in North Carolina, where I'm from, so not too far from you.
Exactly.
And I went to the North Carolina chapter, and this terrific individual sat down next to me. And I looked at her as I would normally do and say, "Are you a HIMSS member?" "Yes." "How long have you been a member?" 8 years.
Wow.
I said, okay, it's great. So you must come here often. She said, "Actually, this is my very first HIMSS event."
Oh, wow. Interesting.
And I went, "Oh, that's really interesting. You've never been to an event before?" She goes, "No." I said, "So how have you used HIMSS?" She says, "I have learned so much by utilizing the professional development."
Oh, interesting.
"The podcasts."
Right.
"The webinars."
Right.
"The certifications that come from
Exactly.
HIMSS." It has had a massive impact and a huge impact on my growth as an individual in healthcare. It's how I stay in touch.
Right.
And because of that, I'm incredibly loyal. And I finally had the time to convince my boss to let me come here.
Right.
And I said, "Well, what did you think?" She goes, "It's opened up an entirely different dimension."
A whole new network of people and associates.
So really where the individual has grabbed a hold of it is often in 3 places. One, how do I develop myself? What are those professional development certifications and the possibilities that HIMSS helps me get to? The second piece of it at the individual level is how do I interact and network? Let's call it out. It's also one of the biggest job markets in the world because you get to know other people and that's exposure, which helps in. And then third, at the individual level, I can hone my skills, but then strategically and the thought leadership allows me to go back into wherever I work or whatever I'm thinking and have an expanded view that I get to share and then share back in.
That's right.
That cycle.
That's powerful.
Is very powerful.
That's right. Yeah. Definitely taking that back and applying it and then helping others see the value of that thought leadership that you're bringing back draws them now, hopefully, to the organization.
100%.
And they become members as well.
Yes, sir.
So I have a final question for you. As you look ahead to the future, what are some of the opportunities or challenges that are facing HIMSS today? And, you hear about all these other organizations that are coming out, they're bringing their kind of flavor to healthcare. How are you planning to lead the organization and navigate it through these interesting times we're in right now?
Yeah. Well, the interesting part about HIMSS is it's very unique than other organizations.
Right.
A lot of other organizations measure themselves by a once-a-year party. We kind of measure ourselves on a 365-day-a-year basis and bringing value to that individual year-round. So our measurement scale is a little different.
Sure.
And because of that, that's why we've grown so much in the last 4 years. That's why we've gone from roughly 80 to 125,000 people in the last 4 years.
Exactly.
Because we focus on the value of the individual, not the party itself.
Sure.
And people appreciate that. And we're not going to change one bit. We're in it for the long haul.
Right.
And that's important for us. And our members understand that.
That's right.
And, there's a person in your Georgia crew. So I'm talking about Seppi.
Yeah,
I'm going to call her out. I'm just going to call her out.
Seppi out, please do.
And she's amazing, right? So she came up to me at the global conference and she asked me a couple of questions and made some requests.
Right.
And we're actually working on it.
Yeah, she told me about them. Yeah.
We're working on it. I call her out because she was my inspiration.
Absolutely.
Right? She also asked me a really simple question that made me kind of go, duh. I don't know why I didn't think of this before.
Exactly.
And then she brought her husband up and he said, yeah, she talks about this all the time.
Right.
Yeah, we're going
to make it happen.
We're going to make this happen.
That's good.
She's on me. But, I think I'm very, very proud of where HIMSS is, our growth, the value we're bringing, and it's getting stronger. Reed Oakes, our product group, Mitch Eisenhower, Christine Buck, our leadership team. And those are just the front-facing ones. Tom Leary in government relations.
Absolutely. Sounds great.
Elizabeth Jasper in our general counsel.
Exactly.
Janella, who works in our HR group, but has much more than that. She's actually our lead administrative officer. This is a really strong leadership team that has been focusing on the development. And God, I hope I left no one out. But
well, you have a great team across.
It's a great team. But this is a unique moment where we're working globally to really improve that value. I have nothing but upside and strength. We continue to grow every month.
Sure.
So sure, there's always been competition. There'll always be competition for Mind Thought. But here's the other piece we're doing. HIMSS is reaching out and developing some very strong partnerships. This is not all about us.
Right.
Again, we're a society.
Exactly.
We have an open arms approach. There's some people who may not want to play. That's fine. But we have an open arms.
Right.
And so we're actually in the process right now of developing partnerships with other organizations like ours.
Sure.
So we can mutually strengthen our professional development offerings to the market. And we're very excited about it. So I think you'll see some announcements in the next few months that are going to say, wow, they've really expanded their fabric.
That's good.
Of the quill. And we're very excited about the future of HIMSS.
No, that's wonderful. Well, we're at our time, unfortunately. I got to get you to your keynote speech here as well, too. So just any final thoughts?
I worry about this one because they have me talking for an hour, and I'm like, how am I going to entertain for an hour?
Oh, I've seen you.
And then questions follow.
Yeah.
So it's going to be, okay.
Man, I've seen you operate. You do that in your sleep. Any final thoughts to the listeners that you'd like to share?
I really appreciate that question. Anything we can do at HIMSS as individuals and people that hear this that either sign up as members,
sure, please
do. And if you have any thoughts, suggestions on what we can do better, let us know. It's a society, as we said, with open arms.
Absolutely.
And we're growing so rapidly and so strong globally. And in North America, by the way, we just continue to grow here too. So we're excited. And this year we'll be launching some efforts both in South America as a part of our Americas campaign.
Wonderful.
We're doing more in the Middle East and North Africa, and we're starting to expand into South Africa as well.
That's right.
It's a really critical market.
Yes, it is.
We're partnering with other NGOs like the W.H.O, Gates Foundation, et cetera. So again, our partnerships are helping us with our global reach. So any suggestions, we're wide open. And we really appreciate spending this time with you.
Hey, Hal, thank you so much for taking time to chat with me and share your thoughts around the future and vision for HIMSS. I, as a 20-year member as well, highly encourage those who are thinking about joining to absolutely join. Those who've been involved are members to get involved and stay involved because it does have a huge impact on our community and our society as a whole. So that's it for this episode of Straight Outta Health IT. Thank you, everyone, for taking time to tune in. As always, I appreciate your support, and your feedback and comments are always welcome. Until next time, take care and God bless.
Thank you so much for listening to Straight Outta Health IT. We hope you enjoyed today's guest. For more unfiltered dialogue of healthcare leaders and influencers, be sure to tune in next week. For the show notes, transcripts, and resources, please visit Apple Podcasts, Spotify, or your favorite streaming platform. We invite you to give us feedback by reaching out to Christopher Cunny on LinkedIn, just searching for Straight Outta Health IT, and you'll find us. We are constantly having live discussions about diverse topics in the industry.